Hi, I'm Dr. John Melnick. I am a radiologist. Prostate cancer has moved into the forefront of my career, partially because I'm interested in it, partially because technology has evolved in a way I don't think that people would have anticipated. What we can do today is so much more precise, so much more accessible. Today, a 10-minute exam gives you a pretty good sense as to whether or not the person has disease. The prostate gland sort of evolves. That's why we've chosen this age of 45 to 50 to sort of encourage people to enter into a screening program. And I just think that it's crazy not to provide this type of service to men. When administration came to me and said, John, we're ready to try to put together a screening program for prostate MRI, I was really excited. So a lot of work had to happen to prepare for this. And what we did was we asked family and friends to come in and to get a free screening examination. So of the population that we brought in, we found several cancers. One of them was a good friend of mine. Another was a colleague, a local internist, who I've gone to myself. He happened to have a family history of prostate cancer and thought he would help us out by getting on the table and letting us work out our program.
My name's Dr. Bernard Schayes. I'm a physician in private practice on the Upper East Side of Manhattan. I've been practicing primary care for the past 40 years. I believe very strongly in prevention. My whole practice is about prevention, getting patients in early before they're sick. So I found out that they offer this test. It's basically a screening MRI of the prostate. So the test was nothing. I mean, it was, I think took 10, 15 minutes in and out.
He came up to my office about 10 minutes after the exam. He said, John, how am I looking? And it's a gulp moment to have somebody who you respect and you work with daily walk into your office and to be looking at a lesion here painted in purple.
Wait a minute, you must have made a mistake. I have no problem. He told me, no, you have a mass and it's pretty serious.
It's just shocking. It's shocking when you look at somebody who you think is healthy, who thinks they're healthy, you run a screening on them and it comes back positive.
It came as a big surprise to me when the prostate screening test turned out to be positive for a finding. PSA was normal, no symptoms. My initial reaction was to be in denial. I said, no, you made a mistake, it's impossible. But then he explained to me, no, you have something.
A lot of that purple signal generated by the artificial intelligence is looking at these closely packed cells, and you can see on these more anatomy-based sequences that the lesion is dark and sort of has a spiculated margin to it. Spiculated margins always scare me, these little spiculations, and those represent tentacles of abnormal cells growing out into normal tissue.
I wanted to find out immediately, what kind of cancer. Was it aggressive? Was it benign? Was it, whatever?
I still get a shiver up my spine when I see those. It's an emotional response, and translating that emotional response from the images to verbally describe to somebody that their cells are attacking them it's a moving event.
I was hoping it'd be nothing and I could just follow it with EPS screening or whatever. Unfortunately, that was not the case, and it turned out to be a very, very aggressive cancer.
We probably had about 150, 200 people come on the table. And not surprisingly, a bunch of cancers were found. To be able to provide this to the whole community is what we're trying to do. We're trying to make a program that has removed as many barriers to access as possible.
The EPS screening, quite honestly, saved my life. I mean, I never would have known about this cancer. And again, my 40 years of practice, I'm very good at prevention. I had no symptoms, no reason to look into this.
I love the idea of EPS being provided to a young population, 45 to 50-year-olds, to create a baseline so that if something starts to get bigger, I can call it. I can call it earlier than if I had to see it the first time and hum and haw about it. I'm glad that we were able to find some cancers early on that study, but it's really about setting this baseline. And this is what what a screening program can provide. It can provide an ability to be more accurate, more precise when it matters. What Dr. Schayes went through as both a patient and as a provider, I think is what we're looking for. We're looking for that from the community to participate in the program. I'm so thankful that Dr. Schayes has been willing to talk about his experience. He really brings both the referring doctor and the patient experience together in a way that can't be described by somebody else. So thank you very much.
My pleasure, my pleasure. But I want to thank you because, as I mentioned earlier, it's not only living longer, it's the quality of life. So this really not only saved my life, but the quality of my life. And this screening for men, when almost 50% of men get this at some point. Why not have the knowledge and know what it is and be able to deal with it? It's so important to catch these diseases early. It really saved my life.